The missing link in back pain. It might be your pelvic floor. Hi, I'm Navdeep Kaur from Emerald Hills Physio. Did you know that your pelvic floor could be the hidden cause of your chronic back pain? Today I'll explain how the pelvic floor is deeply connected to your spine and what we can do about it. Your pelvic floor is part of your deep core unit, along with your diaphragm, deep abdominal muscles, transverse abdominis, and back stabilizers. If one of these isn't functioning properly, like a weak or tight pelvic floor, your back overcompensates. That leads to strain and pain. Signs: your pelvic floor might be contributing to back pain. Pain worsens with prolonged sitting or standing. You have had babies or surgeries in the pelvic area. You feel heaviness or tightness in your lower abdomen or pelvis. You experience bladder, bowel changes with your back pain. Exercise to try: diaphragmatic breathing. Sit or lie down comfortably. Inhale slowly through your nose. Let your belly expand. Exhale through your mouth and gently lift your pelvic floor. Repeat for 1 minute 2 to 3 times a day. Question and answers. I have done core exercises for back pain, but they don't help. Why? You might be missing the pelvic floor piece. Without it, core stability is incomplete. Do men experience this too? Yes, everyone has a pelvic floor, and men can also have dysfunction that affects the back. Back pain is not just about muscles and joints. Sometimes it's deeper. If you are dealing with persistent low back pain, book a pelvic floor consultation at Emerald Hills Physio. Let's treat the root, not just the symptoms.